Welcome to Evidence Mastery with Dr. Massoud Toussi. I am going to help you understand what obesity is and how it is managed. Please note that this video is for education only and will not replace your doctor's advice.
All right, let's get right into it. Today we're talking about obesity. And it's so often boiled down to a simple matter of lifestyle choices, isn't it? But the evidence, well, the evidence tells a much different story. What we're actually looking at is a chronic, multifactorial, and relapsing disorder. It's a really complex disease that's about so much more than a number on a scale. It affects our health on a systemic level.
So here's what we're going to cover. First, we'll nail down what obesity actually is. Then, we'll dive into its incredibly complex causes, and it's truly fascinating. After that, we'll look at the huge impact it has on our health, how it's diagnosed and managed, and we'll wrap things up by talking about prevention and what the long-term prognosis looks like.
All right, first things first, let's get a really clear clinical handle on this. So, what exactly is obesity?
Okay, so the standard clinical definition you'll see most often describes it as a chronic disorder of excess body weight. And the tool we typically use for screening, that's the body mass index, or BMI. A BMI of 30 or greater is generally the threshold. But, and this is really important, that definition is starting to evolve. We're realizing it needs to be much more comprehensive.
And to get a sense of just how big of a health challenge this is, just look at this number. We're talking about roughly 40% of adults in the United States living with obesity. Now, get this, that figure has nearly tripled since the late 1970s. It's become a massive public health issue with truly profound costs, both economically and, of course, personally.
So that leads to the big question, right? Why does obesity even develop? Well, the answer is not simple at all. It is a huge mistake to just chalk it up to a lack of willpower. The evidence points to a picture that is way more complicated than that.
I mean, just look at all these factors. The causes are truly multifactorial. Our genes, they play a huge role. We're talking a heritability of somewhere between 40 and 60%. But it's not just about genetics. It's more like this intricate dance between our genes and, well, a whole host of other things. Lifestyle, sure, but also hormonal signals, the bacteria in our gut, our sleep patterns, even environmental chemicals called obesogens that can totally disrupt our metabolism.
And this is where it gets really fascinating. The role our brain plays. See, our bodies have this built-in system. It's called the homeostatic system that's supposed to regulate hunger and tell us when we're full. But there's a separate pathway, a hedonistic one driven by dopamine, the reward system. And that system can create a desire to eat that can literally override the, hey, I'm full signals. That's where cravings come from. And it shows you just how powerful the psychological side of eating really is.
And this isn't something that just happens overnight. The predisposition to obesity can be influenced at pretty much every stage of life. It can start before we're even born, depending on factors like maternal health. Then in childhood, things you might not expect, like early antibiotic use or going through adverse events, can raise the risk. And as adults, not getting enough sleep and taking certain medications, they can all contribute by tweaking our body's finely tuned regulatory systems.
So when you see just how complex this is, it's probably no surprise that obesity has a massive impact on pretty much every single aspect of our health. It's a truly systemic disease.
You can really see the widespread effects here. You see, excess adipose tissue, or fat, it isn't just sitting there doing nothing. It's actually a very active endocrine organ. Think of it like a little factory, releasing inflammatory molecules and fatty acids into the body. And this leads to systemic inflammation and insulin resistance. From there, the effects ripple outwards. It hits the cardiovascular system, raising the risk for high blood pressure and heart disease. It affects the pulmonary system, leading to things like obstructive sleep apnea. And it impacts the endocrine system, contributing to type 2 diabetes. And it doesn't stop there. It even affects our bones and joints, leading to osteoarthritis and our entire GI system.
And it's so important to remember, the impact isn't just physical. Not at all. The psychosocial burden is absolutely immense. Think about the prejudice, the discrimination that people face. It can lead to really significant psychological distress. We're talking depression, poor body image, low self-esteem, and that, in turn, can affect everything from social life to economic opportunities. Okay, so with all that in mind, how do we as clinicians actually approach this? Well, diagnosing and managing a disease this complex requires a really comprehensive and, importantly, a lifelong strategy.
We talked about BMI earlier, and while it's a common screening tool because it's so easy to use, it has some pretty big limitations. The main issue? It doesn't know the difference between fat and muscle. So you could have a very muscular person who gets misclassified as having obesity. And, on the flip side, you could have an older adult who has lost a lot of muscle, a condition called sarcopenia, and their risk might be totally missed by BMI alone. That's exactly why a comprehensive diagnosis has to look at other things, like waist circumference.
When it comes to management, the approach really rests on 3 core pillars. Pillar 1 is lifestyle modification. That's your diet, physical activity, and behavioral support. Pillar 2, for individuals who need more help, is anti-obesity medications. And Pillar 3, for cases of severe obesity, is bariatric surgery, which is actually the most effective treatment we have. And here's the crucial takeaway. Even a relatively modest weight loss, say 5 to 10%, can result in huge improvements in a person's health. Let's dig into those behavioral interventions for a second, because they're a critical piece of that lifestyle pillar. And again, this isn't about just trying harder or willpower. These are actual, structured strategies. We're talking about building a solid support system, using self-monitoring tools like food logs, developing real coping strategies for stress that don't involve eating, and what's called stimulus control. Basically, changing your environment to make the healthy choice the easy choice. Like not having high-calorie snacks around the house in the first place. Now, in the last few years, the field of pharmacotherapy has just exploded with progress. Take a look at this. It shows the incredible effect of a class of drugs called GLP-1 receptor agonists. You've probably heard of some, like semaglutide. The data here is from a major clinical trial, and you can see that the folks taking semaglutide lost, on average, almost 15% of their body weight. Compare that to just 2.4% in the group taking a placebo. That's a massive difference. And the way they work is pretty neat. They basically mimic our natural gut hormones to help regulate appetite and how much we eat. All right, so finally, let's talk about the long-term outlook, because understanding the prognosis is absolutely key to understanding why we call obesity a chronic disease that needs lifelong management. The evidence is pretty clear on this. Maintaining weight loss long-term is a huge challenge. And I really want to stress this. This is not a personal failure. It is a biological reality. What happens is, after you lose weight, your body fights back. It undergoes hormonal changes. For example, the hormone leptin, which makes you feel full, goes down, and this creates a powerful biological drive to regain the weight. This analysis shows it perfectly. A majority of people end up regaining the weight they lost. And that just hammers home the point that this requires continuous, lifelong management. So, all of this leaves us with a really critical question, one we need to think about for the future. We know obesity is a chronic, relapsing condition. So how can our healthcare systems change to better support people with lifelong management, instead of just focusing on short-term weight loss fixes? I hope you enjoyed this video. Please feel free to share your experience or questions in the comments. Please note that I won't answer personal questions. If you found this video helpful, don't forget to subscribe to my channel. If you would like to have a resource explaining diseases, medical conditions, therapies, and drugs in plain language, I am writing a book which will be published in 2027. Its title is Real-World Evidence, Diseases, and Drugs. Stay tuned.